Hey, everybody. I'm Dr. Kristen Allett, and I'm super excited to be with you here today to talk about new certification that Evergreen's putting out. And I think that it's like really important for this moment. And so it's the Certified Mental Health and Nutritional Clinical Specialist, or the CMNCS. And what's really exciting about it is that it gives professionals who are working with people, and we'll talk about what type of professionals, people, the opportunity to understand the some of the physical causes and the nutritional causes of mental health. So I'm going to let the other two instructors introduce themselves, and then I'll wrap up with introducing myself. But like, this is such an important opportunity for you to consider for your own growth and the growth of your clients. So Vicki.
Thank you, Kristen. That was great. So I just want to introduce myself. This is a really cool setup, the way that we're doing this particular training. So all three of us taped a different day. And so you get the wisdom and advice and education from three different trainers all wrapped up in one training. So I have a doctorate in holistic nutrition, and I'm a licensed clinical social worker. And I've been doing integrative work for over a decade, and I've been in private practice for over 25 years. And I work primarily with kids and adults who have anxiety, depression, ADHD, OCD, Tourette's, trauma. And I have been doing many other trainings with PESI. So some of you may have even participated in some of my other trainings. So really excited that we could piece this together and each of us bring our own expertise, and look forward to having you join us. Vanessa?
Thank you. My name is Dr. Vanessa Ruiz. I'm a naturopathic doctor. I am also a holistic nurse, and I'm really excited about this course because just like Vicki said, it brings our different expertise together and essentially brings our experiences to you guys so that you can use it in your clinical practice. I really love this course because it's really helped others see the mind-body connection and how to be able to apply it in your practice for day-to-day life. And the other thing is that it helps you to understand that maybe it's not just a mental health thing. It might actually be a physiological, pathological thing that could be happening while your patient is anxious or depressed. Dr. Kristen does a very good job of demonstrating, especially in this course, how blood sugar could impact your mood. And so if you're maybe struggling with a client they're not having a stable mood and you're doing a lot of the therapies with them, it's really important to look at the nutrition aspect because that could be the missing piece in stabilizing their mood.
So I'm Dr. Kristen Allett. I'm a naturopathic physician and acupuncturist, and I've been in practice for 20 years, again, specializing in the physiology of mental health, like looking at hormones and nutrients. And the thing that I loved about doing it is the three of us got together because we've had our own successful practices and have been successfully speaking for PESI and Evergreen. And so we understand what it means to share our clinical wisdom. And we got together and we're like, what is the most important actionable things that can happen? And then we had Vicki, who is a mental health professional, and is like, this is the line, because a lot of people are like, where's the line in terms of nutrition and mental health? But the thing that I was most excited is the amount of concrete tools that you're going to get by taking this class. Like, not only like how to evaluate if somebody's getting nutritional needs, but then like how to read labels, or how to sleep better, or how to do what labs would be appropriate for them to be asking for. And so that's been really exciting. And so I'm going to hand back to Vicki because, like, I think one of the main questions is like, how do mental health professionals, because it's not just mental health professionals who can take this, but like, What if your license isn't a nutrition?
So it's a great question, and it comes up all the time. A couple of things. I think what both Dr. Vanessa and Dr. Kristen have said is that it is so important to evaluate clients, not just from a psychotherapy perspective, but also from a physiological, biological perspective. So you have a client that comes in, and you guys know this, if you have somebody who's presenting with depression is, defined by the DSM, but you could have 5 different clients with 5 different presentations of depression. And then the reason that they're depressed are 5 different reasons, or maybe more. And so it's not just about their life circumstance, but it's also about what's going on in their bodies. So looking at if they're eating properly, if they're sleeping, if they're exercising, and if they're not, how do we help them to get there? And digging a little deeper into other things like whether their blood sugar is good and if they're pooping every day, because those things matter in terms of mental health. But that's not what we were trained to do when we got our master's degrees. And so taking this course helps you to take your practice another step to a different level. And it also allows you to stand apart from the other people in your profession, in your areas. So it helps you to grow your practice and serve your clients in a better way. So going back to Kristen, what did you ask me exactly?
No. I just wanted you to speak on because it's always like, oh, you're a naturopathic physician. You don't where's that line of I'm going to make nutritional recommendations and is it okay? And yeah. I have my answer to that, but I think you would have a more grounded answer than what my answer is. And so I wanted to send that off to you because it's so an important question to ask.
Yeah. So it depends. So having this certification can help with that. And honestly, it depends on what state you live in. Every state is different. So what I tell people is know what your scope of practice is within your state, because in the state of Georgia, I can't call myself a nutritionist. I can call myself a nutrition educator, but I can't call myself a nutritionist. But if I moved to Texas and I didn't change anything about what I do and what my credentials are, I could call myself a nutritionist. So it just depends on the law. But no matter what, I tell people, even if you can't do certain things in your state, you need to know what you're looking at so that you can refer to the right people and partner with the right people. So I have naturopaths in my back pocket. I have functional medicine doctors. I have dietitians. So I'm the gatekeeper, and I will say to a client, well, I think that you need to have this kind of lab work done. And so I'll refer them to that person. Or I think that we need to work on your diet, and I can't write a meal plan, but I can refer you to a dietitian, or I can give you a meal plan that's already been written. So I like to talk a lot about how do you stay in your lane and still do this kind of work. So it's really important to know what your scope is. But that's why I also think whether you can actually practice it or not, knowing what your clients need and then finding the right resources for them helps you to still be successful and helps them to get what they need.
Yeah. And part of the reason why it's important to make sure that they get what they need is my experience talking to mental health professionals or PTs or whoever is referring to me is that when the nutritional piece is addressed, then the therapeutic piece, may it be around trauma or OCD or happens because they can make neurotransmitters to rewire their brain. And until those things get stabilized, it's really hard. And so the three of us have really worked to make sure that not only do you have the tools to see what's going on, but there's a lot of recommendations that you can make. You can be like, I'm not prescribing this to you, but we could do an experiment where you could try eating more than one meal a day and see if the panic attacks come down.
Right.
Yeah.
For example.
Yes. I could think of many of those kinds of examples.
Exactly.
Absolutely.
And that's the other thing, knowing what language to use so that you can stay in your lane, but still get the information across. So, for example, you can't say, as a licensed clinical social worker or counselor, you can't say, I recommend you take St. John's wort. But you can say, I know with depression that in Europe they use St. John's wort a lot, and I know the research shows this. So if you would check with your doctor and see if that's something that might be something that you can use rather than taking another medication that you don't necessarily want to try. So it's also learning what language to use, so your clients can still get what they need.
So I think the other thing that we need to address is like who can be in this training. Vanessa, do you want to talk about who this training would be useful for?
So definitely therapists, counselors, anybody in the mental health field. I know that we've also designed it as well for nurses, nurse practitioners, and PAs. And so that's the typical demographic that we've created this for and we see.
And when I was in the process of talking about like who's in there, like this course really could be available to anybody. Like the thing that I really like about it as we went through it is that like it is available to any profession, but I do a lot of work with lawyers actually. And like they're not going to get continuing education credits for it, but it would still be a really good basis because I remember the first time I did a talk for PESI, that somebody came to observe it from PESI and they're like, everybody's paying attention to me, like, and I'm like, well, I'm in the front of the room. Like, who else would they pay attention to? And they're like, no, they usually do something else. And this is so personal. Yes. Like food, sleep, and taking care of your body is so personal. And so you could be doing it for your clients, but ultimately, like we all have to practice this as well. And so unless you have tons of energy and perfect mental clarity, like there might be some tips in here for you, right? Because I think after the last few years, like we're all a little tired. Yeah.
And one more thing, dietitians and nutritionists, like this is a great training because you already kind of know the foundations of nutrition, but just blending it together with how nutrition impacts mental health in a really clear and concise way. And also just understanding like how certain things that you eat is really going to impact not just your mood, but also your behavior, and having that kind of clarity.
Yeah. And then there's some discussion, I think there's some discussion on discerning the difference between doing nutrition or any kind of behavior change for other health conditions versus mental health, right? There's a lot of really good nutritional therapies out there for cardiovascular disease and weight loss, but that's different than mental health. And so this is really focused on what are the best tools for mental health. And one of the things that I find is you can't address almost any other condition unless you stabilize the mental health and in terms of the anxiety and the depression and the fatigue and the mental clarity. And so I'm very excited about this. I hope that people do it and participate in it and give us lots of feedback. And I think that's everything. Did we need to anybody have anything else that they are excited to cover?
Well, I just wanted to share just a quick client story.
Oh, yeah.
So I had, and this is just the power of some of the things that we teach. I had a client who had complex trauma, and one of her big fears was driving. But as it turned out, over the weekend, she had to move and drive 30 hours. So this was a client who was like, wow, this is trigger city for her. And one of the things I had encouraged her to do was just eat enough protein, right? This is something that you share a lot. And so as she started on her drive, she used like basically trying to regulate herself. But one of the big things that really helped her and got her through the 30-hour drive that would have been typically her trigger was protein. And so she made it. She was able to drive safely, but just like think about how stabilizing just that nutritional recommendation was. And then she got the feedback that, oh, I can do this. I can regulate myself. But it's not just like tapping, listening to music, but it's also I have trail mix and protein with me to stabilize. So that's just how powerful this work is.
I love that you just told that story, because I think it's a great way to end this, for people to understand that even though we're sharing a lot of information, that a lot of times the interventions that we need to do are so simple. And so while you might feel a little overwhelmed when you first listen, understanding that sometimes it is simply adding protein, or adding a meal, or adding an hour of sleep, or adding a walk outside. So a lot of times it doesn't take a lot to really shift for our clients. And once they get the sense that they can do it, and they start to feel better with just a tiny little, sorry, my cat's walking through here, a tiny little intervention, then their self-efficacy grows. And so the success just grows from that.
Yeah. One of the recent stories that I was talking to somebody who'd been to a training, and she had somebody who came in who was really dysregulated and suicidal, and this was telemedicine, and she's like, go to your kitchen, we need to get you food. And there's no food in the house. And she's like, I'm sure you have something, go to the kitchen. And they found some honey, and they found some nuts, and she took a spoonful of honey, and within 10 minutes, like, she was available to process what was going on. The suicidal ideation got some distance, because you have to have fuel to your prefrontal cortex. And so not only chronic mental health, but really sharp acute, you will have tools for really sharp acute mental health conditions, which we're just seeing so much of right now.
Yes.
And part of it is that we aren't taking good care of our bodies because we don't know how anymore. And so that's part of what you're going to be getting in this training.
Yeah. So we hope you guys come and enjoy and learn and ask questions. We're excited. We're really excited to have you join us.
Yeah.